Good morning, everyone. I see that I have got our participants that are joining us here in the Zoom room. I'm Bexeho Khalil, and I am the Executive Director of United to End Homelessness with Orange County United Way. And I just want to say a huge thank you to you for joining us today for our second part in our series on young adult homelessness. This series is being co-presented by the Orangewood Foundation and Covenant House California, two fantastic organizations that are at work here locally, serving youth to find housing solutions. And joining me today to help moderate this conversation is Amy Rowland, their Chief Program Officer with Covenant House California.
Hi, Bex. Thank you for inviting all of us to be here today. As many of you know that were able to join the first episode, we brought up the issue of youth and young adult homelessness in Orange County and what types of responses and resources have been developed, have been ongoing, and recently brought online. This session today, though, we want to pull back a little bit and zoom out to understand more about the trends that are affecting young adults at the state level and the national level. And to join us today are two amazing leaders in those areas. First, Kim Lewis, the legislative advocate with the California Coalition for Youth, and Darla Bardine, the executive director of the National Network for Youth. Both Kim and Darla are great partners in the work to end homelessness amongst young adults, but they're also dear friends in the work. Thank you for both of you for joining us today and bringing your expertise. Could you take a few minutes to maybe share a little bit about yourselves and what brought you into the work to serve young adults experiencing homelessness and to be fierce advocates? Kim, do you mind going first?
Sure, Amy, and thank you for having me here today. I am Kim Lewis. I am the legislative advocate for the California Coalition for Youth. I've been actually working with them for over 18 years, and that's kind of where I started doing some policy work and working with CCY early on and presenting at our Youth Empowerment Conference. I got to meet some amazing young people and hear their stories, their lived experiences, and that really dove me into this work because here in California for the longest time, there haven't been many state advocates focusing specifically on young people who are non-system involved. And so I really felt like this was a great way to make a larger impact, to be able to advocate for our young people who didn't have anyone else advocating for them at the state level. Thanks for having me.
Darla, do you want to introduce yourself?
Yes, thank you. Hi, everyone. My name is Darla Bardine, and I'm the Executive Director of the National Network for Youth. I was actually hired as the Policy Director 11 years ago, right out of law school and after a fellowship. I had done policy work for a nonprofit before I went to law school, and I was very committed to working for an organization that was connected to the population that you're trying to help, as well as the on-the-ground community-based service providers. There's a lot of different ways that nonprofits do advocacy in DC. And so when I found the National Network for Youth and their commitment to partnering with service providers, as well as with young people with lived expertise to set a policy agenda and to advocate, I knew that this was the type of organization that I could get excited about working with. And we're celebrating 50 years this year at the National Network for Youth. So that's a little bit about me and us. Thanks for having me.
Well, thank you so much, Kim and Darla, for those introductions. I'm so excited to learn from both of you today and from all the expertise that you are bringing to our conversation. As I mentioned earlier, this is part 2. The first session is available on our YouTube channel. And during that session, we spoke with Tiffany from the Orangewood Foundation and Shelby from Project Hope Alliance about youth and young adult homelessness in Orange County. They did a fantastic job of sort of laying the stage for today's conversation and really talking about the focus as we're looking at this around 18 to 24-year-olds who are often hidden from our general view of homelessness. These young adults might be sharing homes, they're couch surfing, they're in crowded situations. And we had quite a robust conversation about what that sort of can look like in Orange County. But today I'm excited to zoom out and to be able to talk about this at a state and national level. And so that is my first question to both of you. And Kim, I'll start with you. When we talk about young adult homelessness across California, share with us some more about what this looks like.
Yeah, no, great question, Bex, and happy to share a little bit more about what we're seeing in California at the state level. California does have the largest share of young people experiencing homelessness across the nation. Almost 30% of our young people are experiencing homelessness. And I have a few numbers if you want to share that, just because I know sometimes numbers can be challenging for folks to write down. But over 10,000 young people, according to HUD's point-in-time count, were identified in last year's PIT counts. So, and then we also, from a CCY perspective, have really been focusing on ensuring that our parenting youth and their children are also captured when we talk about at the state level youth who are experiencing homelessness. And we have another 2,200 parenting youth and their children, because we really want to focus on the development of the young adults as well. And so we want to make sure that we're capturing them in our work that we are doing for youth homelessness. And then, frankly, just to give a little bit of contrast, since I know you talked about this a little bit in some of the definitions at the previous webinar, the California Department of Ed is probably the one school system that can actually track and report on how many young people are experiencing homelessness in schools. And within that, they also actually break out our unaccompanied students. And just over 8,500 students in last school year reported homelessness according to the McKinney-Vento definition. And so that's actually almost, as much as we're seeing in the point-in-time count. So I think that really kind of presents a kind of dichotomy of what we're seeing when we count young people. And unfortunately, there's an overrepresentation in the research of our young people who are Black, Indigenous, people of color, as well as our LGBTQ+ populations within the homelessness space. And so I think, it's just a bigger problem than I think our counts really show. And so that's kind of where we're at a California level.
Thank you, Kim. Darla, when we translate this to the national level, what do we see? Is it similar trends?
Yeah, we also have a slide because, numbers can be hard. So our most recent research nationally, that is actually comprehensive of all forms of homelessness that youth and young adults experiences, was conducted by Chapin Hall. It was federally funded, and it uses the Runaway and Homeless Youth Act definition of homelessness, because this study was actually authorized by the federal Runaway and Homeless Youth Act program. And that research found that 4.2 million youth and young adults experienced homelessness within the US within a 12-month period. And so that number is like crazy. Like, what is that in reality? And so that's why you kind of see these infographics here. That breaks down to 1 in 10 young adults. So that's when we say young adults, we mean 18 to 25-year-olds. So 1 in 10 experienced homelessness over a 12-month period. That's approximately 3.5 million young adults. And then 1 in 30 youth ages 13 to 17 experience homelessness over a 12-month period. And what those numbers capture is any length of homelessness. So like 1 day homeless, a week, several months. And it also includes hidden and visible forms of homelessness. So street homelessness, car homelessness, but also couch hopping and other forms of homelessness that young people experience. And the number for the minors was clearly much lower. And that was a little bit because of the how the research was conducted. So minors couldn't self-report. So that minor number was contingent on someone 18 and older basically disclosing that they knew firsthand of someone under the age of 18 who experienced homelessness. But that was the only way they could ethically kind of conduct, Chapin Hall could conduct that research. So just a little bit more about the data, but clearly it's a large issue, and current investments are nowhere near meeting the needs of all those young people.
Thank you, both of you, for sharing about that. And And I want to just highlight for anybody who's joining us today who wasn't with us last time. A point in time count is very different from the data that Darla was sharing. So Darla's data was looking at a period of over a year. So really getting that understanding of what is happening, January to December. And so that number is going to be really helpful for us to actually kind of understand the size of what we're looking at. Point in time counts are looking at just a little 3-day window in January. And so that number is always going to be much lower than what's actually happening over a 12-month period. And so I just wanted to make sure that I reiterated that for anybody who's watching, who's like, oh my goodness, these numbers are, pretty different from each other. And it's really important that we look at all of them together to really have that better picture. We can't just rely on one data set to understand what's happening. So I just wanted to jump in there, but I'll stop talking now and I'll pass over to you, Amy.
Great, thanks. So I wanted us to pivot a little bit and hear, both of you have been in this work for a long time, a couple decades, and your agency's even longer. So could you spend a little time talking to us about the changes in regards to how young adults experience homelessness, from back then to now, and what are some of the shifts that you have seen that you could share with us today? Darla, do you want to go first?
Yes, I think I'm kicking us off. Bex, thanks for that helpful kind of explanation of the different data sets. I appreciate that. Yeah, so, the National Network for Youth has been around 50 years. It's older than me, I'm proud to say. And over my 11 years, I've seen a pretty significant shift in kind of the youth homelessness movement. We have a national perspective. We represent over 300 youth homelessness providers from across the country, and we partner with youth with lived experience from across the country. And really, when I came on 11 years ago, there was still very much kind of this crisis response focus. But over the last 11 years, there's really been a shift to thinking around prevention, to really doing a better job at focusing on young people who are exiting child welfare or the juvenile justice system. And not just talking about how it's an issue, but thinking of solutions like vouchers or direct cash transfers, or giving young people in those systems rights and doing better reentry planning, or focusing more on improving family supports, as well as, I think, really acknowledging the need to invest in community-based supports outside of those systems to support those children, youth, and families when they're in early crisis and not waiting till they're chronically homeless. But I've also observed that funding continues to be targeted to, the response system for chronically homeless adults. And so in spite of, I think I have another lovely slide here. But, in spite of, so there's all this research, okay, showing that, 45, 48, 52% of our chronically homeless adult population actually first experienced homelessness when they were under the age of 25. Yet investments in the youth and young adult population, so those who are experiencing homelessness when they're under the age of 25, the investments in actually preventing and responding to youth and young adults experiencing homelessness has remained chronically underfunded, even when we've seen pretty significant to the tune of several billion increasing in federal investments to the HUD homelessness response system. We've seen, $100 million a year, and for the youth homeless demonstration program, which is tiny compared to the multi-billion-dollar bucket. So we continue, I think, to struggle to capture the attention of legislators and policymakers that if we truly address youth and young adult homelessness, you're actually going to cut the chronic adult homelessness population in half. You're not going to end chronic adult homelessness if you continue to make people get really sick and become chronically homeless adults before they're eligible and prioritized to receive the housing and services that actually they needed under the age of 25. So we continue to beat the drum, but I will say a lot more people are supportive of kind of those policy changes and a shift in investment. A lot more kind of support for, changing the HUD definition of homelessness, increasing investment. We've seen now, even this year alone, than we had even 11 years ago.
Yeah, great. Thank you, Darla. I think like you hit on like so many like important nuggets that are really, vital for all of us in the work in Orange County and in California to keep saying and keep lifting up around investing in young people early on stops the pipeline to chronic adult homelessness, and the data around how more than 50% of folks had their first episode of homelessness before they were 25 also just like illustrates that really well. I also wanted to just say briefly that in my 10 years at Covenant House, and the first, like 15 years of my career were in, child welfare and juvenile justice systems, like doing group homes and transitional housing, and just really seeing a decrease, which is a good thing, in the number of former foster youth that experience homelessness. So when I started at Covenant House in 2014, more than 55% of the youth that ever stepped into our shelter had touched the child welfare system in some way in their life. And, AB 12 now has many years under its legs here in California. And now we're seeing almost 31%. So that is a significant decrease. It's not enough, but I do think that, we have moved the needle on a lot of things. And I really appreciate, how you shared that national perspective. Kim, can you oh, sorry. It looks like Bex wanted to say something.
I was just going to jump in there. Amy, for anybody who's watching AB 12, I know that in this world, we throw around things.
Totally. Yeah.
Talking about
AB 12 is the extension of foster care for youth that California passed. I want to say that was like 2008, 2010, maybe it was 2010, so that youth can opt in and stay in care from 18 to 21, so that they don't have to emancipate right on their 18th birthday. There's rules and different things, but there's housing and benefits and support that they're eligible for that I do believe has decreased the number of foster youth that have experienced homelessness in California since. I think that's probably where I met Kim.
Probably.
Doing AB 12 advocacy. Yeah. Okay, Kim, so we're going to pass it over to you just to hear a little bit about some of the changes that you've seen at a state level.
Yeah, no, I think that's great. And I think it's similar to what's been happening at the national level. But what I would say in California, we were really good, I think, in the 70s and 80s around status offenders, recognizing that work around juvenile justice, to focusing on youth homelessness and passing stuff. And then before my time, clearly, and then there was this big vacuum for many years. And like our political systems really focused on things like mental health and the child welfare system and foster care. And it really wasn't until, I'd say, with the passage of kind of this refocus on extended foster care and allowing young people and recognizing how many had been system involved that exited still unsuccessfully to the streets and just weren't set up for self-sufficiency, the kind of the shift in the focus of the state policy of recognizing, well, what does that mean for our young people? And so there's been much more focus, I think, at the state level around young people, and we still struggle a lot around prevention. I think it is a hard thing from policy making to really put dollars into a prevention space when you're like, well, I'm not totally clear what the outcomes are going to be because we've prevented all these negative outcomes, so I can't track and data and measure all that. And so that makes it a little harder for the argument to be like more responsive, right? When we have fires, we have storms and all of that, that's easier for governments to say like, yes, we have to invest. But I think that's always been a challenge. And I think the other challenge we've seen is because a lot of the times the way our continuums of care operate historically, all that data has always gone to the feds. And so we've always just done that through coordinated entry and put it our systems. And then we weren't really at the state level. We were feeling like we're a year, almost two behind on seeing what was happening in our communities. And so I kind of have a slide on that because the state took some action more recently to try and grab that data in real time and have COCs also be reporting to the state through its, what we're calling our homeless data information system. So our council, our interagency council on homelessness, which took many years to also pass. It took us quite a while to get one set up in the state too, to actually have a data system to also be collecting this in real time. And I think this is really interesting because the data is showing a lot more young people accessing services through systems than what we're counting. And so as we grow the data, I think that's been a huge thing to help and change, because more folks are focused on the needs of our young people, and really paying attention to that. And then all the brain science research that's kind of come out around the developmental stage for the developing mind, adolescent mind, has been another piece that's really been driving the work. We have done a ton around juvenile justice reform and thinking differently about our young people. We've shuttered our state prison system for young people. So now young people all stay locally. So the recognition on the justice side and the fact that young people's brain science around the development and the choices they make as young adults aren't necessarily things that should stigmatize them later in life. And so that kind of evolution is also bringing things differently as we're thinking about how do we serve our young youth and young adults in California. So I think that's all kind of been the shift. And I think a lot of the research has really helped with a lot of that. So maybe stop there.
Thank you, Kim. It's frustrating to hear that we haven't been able to look at this data, in real time for a while. And so I was trying to think, I'm excited that we can now, but I'm also frustrated that, with something that, just to get systems to talk to each other is so challenging. And the results of that are just devastating, for the actual people that we are trying to help. And I think that's just fantastic that we're able to see the data of what is happening, that CRC data is now being put up to the state and the state is able to look at that. And I know locally, we do a data request to our continuum of care every year to find out how many people have been through our homeless management information system. And we look particularly at subpopulations, and I had just pinged the team to see if I could get the number so I could drop it in here at this moment about what that looked like for 18 to 24-year-olds, but it hasn't arrived with me yet. So I'll bring that number back in a second. But the number of people that move in and out of the system over the year is so much more significantly higher than what we see in a point in time count, which again brings us back to the importance of looking at different data sets together. And not just taking one thing in isolation. We know, the cost of living in California has increased exponentially. And we know that when the cost of living rises, we see increases in homelessness. And I know that young adults are certainly not immune from the negative impacts of the cost of housing rising, but I know that there's also more to it for young adults. And so, Kim, can you shed a little bit of light on some of the things that are really impacting young adults when it comes to being able to access housing?
And I'll just say housing is like a huge crisis in this state. We all know housing affordability and availability is a challenge, and that is impacting all populations, from our low income to our middle income as well. So it's impacting those classes definitely. And I think that's one piece of it. And I think we also have to recognize too, like our young people are in different developmental spaces as adults, right? So as a young person coming into getting your first place, you often lack a rental history, right? And we don't have that kind of record about who's gonna vouch for you on a rental application. Your credit may not be great because you may not have credit, and credit is just a natural. It only gets better as you get older. So it's not something, it's like, that you're gonna correct as a young person. You're just at a natural disadvantage when it comes to that. And so there's also, sometimes stigma, and it doesn't just apply to our young people experiencing homelessness, it's youth in general. Right. I think there's a lot of stigma about renting to a younger adult versus somebody who's maybe in a family. And that's just some of the bias that happens when you've got a really impacted system and availability of housing locally. And so, young people are navigating all these different things, plus, needing to have deposits and all of the cost of getting your first place. Thankfully, in the state, we passed a bill last year, AB 12. By Mr. Haney, not to be confused with the one Amy was just talking about, extended foster care. But starting on July 1, landlords will be prohibited from charging more than double the amount of rent to kind of move in. So you can only charge first month and a deposit. So you're capped at how much that entry cost is. And for our young people, especially in high cost communities, that can be like in San Francisco, where Mr. Haney's from, that could be almost $10,000 is what people were charging just to move into a rental property. So for our young people, like having the deposits and all those upfront costs can be a huge challenge for them to be able to kind of overcome. So there's a lot to it. And then I have another slide because I also want to share when we're thinking about our housing continuums and our housing inventory counts that we have. This data comes from the California Homeless Youth Project, which is housed at the state library. And they kind of did an analysis about the number of beds that are available statewide. And they only identified that there was just under 6,000 beds specifically for young people in the state, and that we have a great need of almost 77%. So 20,000 beds we still need to build just for young people experiencing homelessness. And that, stark contrast that only 3% of the beds statewide are actually for our young people. And so the housing inventory count captures not just our shelter beds, but transitional housing beds, rapid rehousing, and permanent supportive. So it has that continuum in there. And so I think there's a huge need too that our young people lack access to beds in the first place. And I think when we are thinking about housing our young people, we want to think about moving through that continuum, right? Because there's also a lot of research out there around young people need to build trust, because I think about it, all the adults in their lives have failed them. So it's going to take them time to connect with service providers, touch base, and really vet you in their own way and say, like, do I trust you enough to like come in, because everyone else I've worked with has failed me. So drop-in centers to shelter to transitional housing to also affordable housing units and permanent housing units. We need to have that kind of built continuum for our young people to be everywhere, frankly, and having safe places for them to come into and access. So it is more than just housing, it's that continuum of the flow that we need.
You said something that just really struck me. You said that for the young person, every adult has failed them. And I just kind of wanted to like pause there, because that was something that I want to just take a moment to reflect on. And when we're talking about how our systems have failed young people, our systems are being run by people. And then for the young adult who then finds themselves without anywhere to go, the only things that they have that can potentially help them are, once again, systems. And systems that are being run by adults. And I think this is something that we often don't really stop to think about. And it's something that we've dug into in this community chat series, is around this notion that we hear about people are service resistant. And we've spent significant time like debunking that myth on a community chat. But as you shared that, Kim, it just really reminded me of the conversations that we had around that, and how important it is that we flip the script on that, and really think about the way that services are offered, the way that services are delivered, the importance of building trust and rapport and follow through, and how challenging that is when our system doesn't have the resources, hasn't been adequately equipped with the funding that it needs to truly address the issue. And how challenging that is for everybody in the space that's really wanting to make a difference. And I have the numbers now. So in 2023 in Orange County, we had 2,217 unique 18 to 24-year-olds that entered in and out of our homeless management information system. And our point in time count, I believe it was 308. So just wanted to highlight locally the difference between those two numbers. And we know that not every 18 to 24-year-old who was without a roof over their head actually engaged with our system. So that 2,217 number is in fact much, much higher. And our inventory here locally in Orange County in terms of emergency shelter beds, rapid rehousing opportunities, the whole range on that continuum, I would venture to guess for youth and young adults is lower than that 3% that you were talking about, Kim. But I digressed. I went down a little rabbit trail, but thank you for coming with me on that. So Darla, I'll come to you. Well, any national trends, and I think we've sort of hinted at some of these along the way, but I want to come back to you to give you the opportunity to really call these out. What are we seeing that's affecting young adult homelessness on the national scale?
Yeah, I mean, there's definitely bright spots, right? I think we're seeing, from where I sit, more and more communities coming together where there's multi-system stakeholders, within a county, within a community that really want to have a plan, really centering youth with lived expertise and letting them take the lead and helping to restructure systems. So definitely bright spots there. We've never seen, I think, this amount of energy across the nation in communities. And yeah, I think it's partly because of the HUD Youth Homeless Demonstration Program grants, the Youth Homeless System Improvement grants from HUD. We have the Prevention Demonstration Grant from the U.S. Department of Health and Human Services through the Runaway and Homeless Youth Act. So there's definitely been like these interesting small buckets of federal funding that I think have activated communities. I think where we continue to run into challenges is there just hasn't been kind of the systemic change in homelessness policy nationally that is needed for any of the kind of even interesting and good practices that started under YHDP to be required to be maintained within a continuum of care. It's still very much up to the decision and whoever's in power of HUD Continuum of Care, which is a local body that gets federal money from the U.S. Department of Housing and Urban Development to address homelessness within a community. And those priorities are still being set, by the federal government, and it's still continuing to target their resources to chronically homeless single adults. And so we still are working to kind of fit young people into a policy that was written for adults. And there continues to be barriers for young people in terms of what their homelessness looks like, the access to paperwork, having a valid government ID, being required to have a parental signature to access some programs if you're under the age of 18. And so for us, we really work to address and try to remove those barriers. But even more than that, I think we've gotten to a point where federal policy, just like state policy, and Kim and Amy, you guys have given some great examples of what California has put into law, rights and resources, which a lot of other states don't have. Most states don't have any state funding for youth and young adult homelessness. They don't have any funding for young people aging out of foster care, no rights to extend it. So you all are actually in the minority in terms of having those policies in place. And so for me, it's really about giving young people actual rights and requiring communities to actually have specific services and programs targeted to young people with accessible access points. To the thread of conversation before, we hear time and time again that it's often one person that built a trusting relationship with a young person in crisis that made the difference for them in exiting homelessness or not. And those relationships weren't created through coordinated entry intake survey completion. It was just not at all, not in, the system, like you were talking about, Bex. It was like a high school guidance counselor, a football coach, a teacher that took an interest, a drop-in center worker that really, connected with a young person, or a street outreach worker. That's why, in the youth and young adult space, having investments in drop-in centers, in street outreach programs, in kind of schools and other places where young people are, accessing other programming, spending time, on the street or other community centers. It's vital that there are adults there that are consistently showing up and building those trusting relationships, because they've been let down by systems, and adults throughout their whole life. And the other challenge is a lot of young people will enter a housing program and then they'll leave and then they'll come back. And again, it's part of where they are developmentally, but it's also part of their process of building trust with the adults that run that program. But unfortunately, under federal HUD policy, it's actually a negative outcome for that young person, and then ultimately for that provider. So in the youth space, we actually consider it to be a positive if a young person blows out of a placement and comes back, because that means we're actually building a trusting relationship with that young person. But HUD policy considers that a negative outcome. And the service provider gets penalized. So when it comes to tier ranking, our youth providers will often get ranked lower, because the metrics that they're required to report on are metrics that were actually developed for chronically homeless adult providers and not providers who are serving this developmental age. So those are just some of the what we're seeing and what we're working to try to change in federal policy.
Yeah, thank you so much, Darla, for lifting that up at the end, because I do feel like, from my perspective, at running Covenant House and with other youth providers that I work collaboratively with, that's the kind of bell we're always ringing, that it's relationships. Relationships are the secret sauce that are going to help young people do better, thrive, and move along in their journey out of homelessness. And then we're, beholden to like the outcomes and the expectations of funders. And so then as youth providers, we have to get really creative about braiding that funding so we can do the right things. And what that looks like for me is like more thoughtful consideration about what that transition from street to a bed. I mean, thinking about young people maybe wanting to sleep on the floor or wanting to sleep in the community room before they go to a bedroom where they don't feel safe or have trusted adults in their life. And how do we build in that like period of time to just come inside, take a breath, get to know us, build relationships with the staff and the case managers and the folks that are in, in the program or the housing support, teaching them how to be a neighbor to their neighbors, because I would have a hard time surviving without my neighbors' support. But I think a lot of times we expect like, okay, now you're in, you need to get a job. You need to be back at this time of night. You need to do these things. You can't just sit on the couch. You got to get moving. But like, what would it look like to let young people exhale and recalibrate? And sometimes the unintended negative consequences of a program or how we want to run things because the funder says we need to hit these outcomes actually negatively impacts young people. So we do a lot of celebrating when someone comes back after we've had to ask them to leave or they've chosen to leave, because you came back again. You're choosing your life. You're choosing the next step on your journey. And so I would say that that's true in our shelter in Orange County. I think in Orange County, another trend or thing I want to lift up that's unique-ish is that we have a disproportionate percentage of youth that identify in the LGBTQ plus population. And, nationally that stat is right. 40% of youth experiencing homelessness identify as LGBTQ plus, but in Orange County, our percentage is considerably higher than any of our other sites in the state, and young people coming in just don't feel safe anywhere else. And so just kind of thinking about how do we make sure our spaces are safe and inclusive? And young people, a lot of focus groups, a lot of listening in my 10 years, they do not feel safe in adult shelters. And that doesn't mean adult shelters are bad or wrong. It's just they are quickly victimized, quickly exploited or pulled into things, and also just do not feel safe. And that we need to, kind of figure that out in this community, because the gap between permanent stable housing with a voucher or rapid rehousing or whatever the housing destination is, there is this gap where there's no safety net. And so I really appreciated, though, that you lifted up the relationships, because I think like that's what makes youth programs and youth providers so special too. So I know we're kind of, we're on a schedule, and so I just want to bring us back a little bit in line with this concept, but I want to bring us to the definitions, because I think like for the 50 years National Network's been around, and all the years the California Coalition for Youth and other advocacy providers have been at the table, the definition around homelessness and how that translates to young people and youth is part of where resources, funding, and attention hasn't been placed appropriately. And so maybe Darla, you could start with just talking a little bit also about perceptions and what you've encountered to raise awareness and action, and maybe touching on those definitions.
Yeah, absolutely. Yeah, so I think often the public perceives homelessness as like someone on the street with a cardboard sign, right? And what we know for young people experiencing homelessness is they do feel incredibly unsafe, incredibly vulnerable, certainly not wanting to access a typical adult shelter because, again, they feel unsafe or often preyed upon. And so young people try to hide. I mean, they do not want to be, necessarily out there on the street with everybody knowing that they don't have a place to live. One, because of just their developmental age and stage. They want to be like every other young person their age, teenager, young adult, they want to fit in with the crowd. So they'll work really hard not to look, how the general public expects people experiencing homelessness to look. And they'll stay, in any place to not be detected by child welfare. They have a lot of fear of, being arrested or being forced to go home, because a lot of young people's pathways to homelessness is family conflict, abuse, domestic violence, substance use disorder, getting kicked out because of their sexual orientation or gender identity. And so there's a lot of fear of being forced to go back to a situation that for them felt unsafe. And I also think in the definition issue, we hear a lot that, the visibly homeless are the most vulnerable, they're the most, at risk. And that's not what the research shows us. The research for young people does not show us that the hidden homeless young people are more safe than the visibly homeless young person. In fact, I'll never forget, one of our young leaders said that the open sky never made her bleed, and she never felt safe in her home. She felt safe as sleeping outside in the forest. And so I think there's just kind of this narrative that isn't backed up by data that the visibly homeless are more vulnerable than the hidden homeless situations that young people find them in. And I think I have a slide with some more data. So with a citation, so it's not just Darla from the National Network for Youth saying a thing. The research actually backs us up. But it shows that actually homelessness is also this fluid experience. I think that's the other myth we have to debunk, is that everybody experiences just one form of homelessness. You're either on the street, or you're on a couch, or you're in a shelter. And so it's actually, a very fluid experience. Young people will bounce from a bench to a shelter, to a couch, to a car, to a hotel. They'll really just sleep wherever it is the safest place they can find. And so this research, again, from Chapin Hall, found that 72% of youth who experience street shelter and car homelessness, which is homelessness under the U.S. Department of Housing and Urban Development, also said they stayed with others, which staying with others would not be considered homeless under the U.S. Department of Housing and Urban Development, but it would be considered homeless under the U.S. Department of Education and the U.S. Department of Health and Human Services. So it becomes a pretty significant policy issue when you actually have pretty significant federal funding streams from different federal agencies going into a community that actually don't agree on the definition of the social problem that they're supposed to be working together to address, right? So with the continuum of care, you're supposed to have the McKinney-Vento homeless education agencies, the federal Runaway and Homeless Youth Act grantees funded through the U.S. Department of Health and Human Services, and then, of course, the U.S. Department of Housing and Urban Development. You're all supposed to come together, create a plan, prevent and end homelessness, but your funding streams aren't operating under the same definition of homelessness. So there tends to be a lot of tension. And what we have seen is then frustration, and then certain community partners disengaging because you don't actually have the same goal in mind, right? Whenever HUD with the most money is saying, no, this money needs to go to chronically homeless single adults, that's a prioritization metrics that we're going to put in place through coordinated entry. That's where the funding is going to go. That's where you're going to get the most points on your funding application. But then you're like requiring these other partners to be there, like, well, but our young people are homeless too. And we have research that tells us that our young people who are not HUD homeless are equally as vulnerable. And that actually where a young person happens to find a place to sleep the night before shouldn't determine if they're eligible or not, because again, it's a very fluid experience for young people.
Yeah, great. Thank you. Oh,
yeah, thanks.
Yeah. Just to kind of move along, we've touched on this in a couple different places, but I'm hoping, Kim, you could just share a little, because I know this is a lot about what we talk about at CCY and when we do legislative visits, about how there's an assumption that all youth experiencing homelessness are system involved or have been system involved. Could you take a few minutes to talk about that, please?
Yeah, no, of course. And I think all the reasons Darla talked about of all these experiences that come from the home environment and the experiences do and would necessitate system involvement. But again, there is a very unique process and specific process to bring young people into child welfare. And it takes time, and there's a lot of investigation and work that goes into that. And if they're 18, and they've turned 18, we can't enter them after 18. And so I think, again, we know that we've invested a lot on the child welfare side, and especially through the extension of foster care through 21. And so I think policymakers think like, well, yeah, of course, these young people have had these negative experiences. So of course the system intervened. And oftentimes we will see that young people have similar stories. They were just missed by the system, and often why we talk about them falling through the cracks. And when we are doing policymaking, I think California has term limits. So for our legislators, there's turnover. We've had a third of the legislature turnover in this past term. We're going to have another third turnover next year. And so it's a constant re-education and informing folks, because when we talk about the negative experiences, the assumption is just made that of course there's system involved. And so I think that's really when we structure our programs, because I can only change state law because that's where I work at. So when I'm saying, great, let's make sure our state funded dollars are used to plug the holes that the federal system isn't doing, right? And so that's why we were very intentional in the HAP definition around homeless youth being unaccompanied youth who meet the McKinney-Vento definition, who are also pregnant and parenting, so that we're really trying to be very intentional of saying to our communities, like, when you're thinking about designing it, we know HUD's going to tell you to do certain things, but use your state dollars to fill those gaps, because we have given you that flexibility to be able to do it differently and capture those young people that maybe are getting missed in other places that Darla is talking about. So I think, that's just kind of how we try to structure it and what we can control, because I can't control the feds yet. So I'll stick to what I can do.
Yeah, thanks, Kim, and thanks for bringing up HAP. For anybody who is like, what does that acronym mean? Kim, could you explain what HAP is?
Yeah, it's the Homeless Housing Assistance and Prevention Program. That is state funding, $1 billion. We are in currently round 5 of funding for continuums of care, large cities and counties to be able to get additional state general fund dollars to help support their homelessness response system. I will say the two-house party agreement that was announced yesterday announced that they are going to provide $1 billion in round 6 funding for another round of HAP dollars. But of course, we need to get the governor to go along and make sure it stays in the final deal. So some positive news, but our work is not done. But the dollars are really flexible in terms of funding a lot of the prevention work and other pieces of the system that folks have been asking for.
And Kim, can you share what percentage of HAP had to be allocated to young adult homelessness?
There's a minimum that they must spend a minimum of 10% of your allocations on young people. This is not intended to be a ceiling. It is intended to be a minimum floor. And so I really want folks to think about what investments are we doing, because you just heard also that young people don't feel safe in adult shelters. So are we creating and funding programs that are designed for their developmental needs in mind? So am I actually funding a young adult program for youth to want to be together? I mean, that's also our Tay, because they're in transition, right? And as you think about maybe your college years, and I think about that, you're with your peers all the time. You're living in dorms and all that kind of stuff that a young person maybe in college would do. It should be no exception for a young person who's experiencing homelessness. And that is also a healthy part of relationship building that they need to do and develop in their TAY years or transition age youth years.
Yeah, thanks, Kim. Both Amy and I serve on the Orange County Continuum of Care Board. And so as you heard Kim mention that continuums of care have received allocations of funding from HAP, and continuum of care are also the entities that receive the federal funding from HUD that Darla was talking about. And what is sort of interesting is the state funding says minimum 10% of HAP must go towards addressing youth and young adult homelessness. HUD's funding doesn't have that. And so for our continuum of care here in Orange County, we only started making like thoughtful, intentional investments in addressing youth and young homelessness when HAP came on the scene. And as you heard from Kim, HAP has been around 4 years. We're going into round 5 and round 6. We're in the middle of applying for round 5. We've all applied and we haven't heard yet.
2019, we've been around since for the HAP. And then there was the HEAP, the Homeless Emergency Aid Program, which preceded that one in 2018. And again, we have increased the set aside from 5% under HEAP to the 10% it is today. So trying to get folks to recognize, again, at least some minimum spend.
Yeah, thank you, Kim. I wanted to highlight that, as I think that is something that the state of California has done really well. And when it comes to the funding for HUD, if you want to go after funding specific to youth and young adult homelessness, you have to compete nationally. Darla was mentioning YHDP, the Youth Homelessness Demonstration Program. That's a national competition. Our community has applied twice. We haven't been awarded yet. We're going to keep applying until we get there. But it's a challenging competition when you're competing across the entire country. And I think Darla also mentioned the youth homelessness system improvement, new, really exciting opportunity for funding from HUD. But again, a national competition. Orange County applied. Well, actually, United Way applied for our community. We are eagerly awaiting the results from HUD, just like many other people are around the country, to find out what's going to happen with that. But I think I just kind of want to hold that. The state says minimum 10% of this funding must be used to address young adult homelessness. And when it comes to the HUD funding, we are all competing with each other to get access to specific funding. And there isn't that requirement from HUD that through your general NOFO process that you must have a set aside to address youth and young adult homelessness, which, as we've clearly heard, is an investment in preventing chronic homelessness down the line. So let's talk about advocacy. How can anybody who's watching get involved in helping to advocate for some changes that are needed at the state and national level? Darla, I'll come to you first.
Yes, I think I have a lovely slide with hyperlinks. So we have several campaigns linked to legislation. Oh no, the last one is really big. We'll fix that. But the hyperlinks, you can actually just click on a link, put in your information, and you can send an email to your US representatives asking them to co-sponsor. So we do have that technology on a website. Bex, you took the words right out of my mouth. I wish we had at least a 10% set aside for every continuum of care with federal dollars. But it is tough. There is just opposition and lobbying against, aligning federal definitions, doing any type of set aside. We even struggle. We've been asking for there to be kind of youth specific outcome measures for youth funded projects through the continuum of care to be put into the NOFO. We have faced pushback there as well. But on our website, we do have the Homeless Children and Youth Act. Sorry, that would align the federal definitions of homelessness. It is bipartisan in the House. It will be introduced hopefully in the Senate later on this year. We also have the Runaway and Homeless Youth and Trafficking Prevention Act. That is bipartisan in the House and the Senate. That would reauthorize and expand the federal Runaway and Homeless Youth Act program. which you heard about, and it would add prevention services funding stream, but also increase length of stay and increase age from 22 to 25 for programs. So a lot of kind of important updates. We have the Housing for Homeless Students Act. So right now, if you are living in affordable housing built with a low-income housing tax credit, you can't be a full-time student. And so that legislation would actually change that so that you could be a young person living in affordable housing built with LIHTC, as the acronym goes, and pursue an education full-time. And then there is the Housing for Homeless and Foster Youth Act. And so that would create a single point of contact on colleges and universities for homeless and foster youth to support them, not just in entering and getting into college or universities, but also provide support throughout their college career so they actually get to graduation, because we know that graduation rates are low for homeless and foster youth in college and universities, just like it is in K through 12. So you can go to our Take Action Center, click on the links on the slides and get involved. Thanks.
And we will send the slides out. I know we have people are like, we want the hyperlinks. We will email everybody who signed up we will email you all the slides, and certainly make sure that you're able to join in action advocacy. Kim, what's happening on a state level?
Yeah, CCY is working on quite a few things, and I have a slide too, just because it's easier to keep that up there. But one of the things, housing is, we talked about, is a big thing. A housing bond is being in the discussion in the works this year. So we have SB 1079 to have a youth housing bond out there for $1 billion. It is moving through the process with Senator Menjivar out of San Fernando Valley. And we'll see what we can get in terms of, hopefully by the end of this June, we'll have to get something wrapped up and finalized so it can be on the ballot in November in time. We've also been working on HAP dollars to ensure that we want ongoing. We'll take around 6 for now. We want to continue to increase that minimum set aside for young people, and kind of fix some of this weird language that was included in round 5 around interim housing for young people and making it more challenging to do. And I'm hopeful I'll be able to see the details, and we'll have some fix hopefully in this budget deal that's getting announced. We also have 2477 by Mr. Zabur, which is part of our prevention strategy to ensure that, again, young people exiting systems, so foster care, can actually accumulate savings. There's some old law in the books that is creating a barrier for young people to accumulate more than $10,000 in savings when they exit care. So we want to fix that so that we're not setting them up for a negative outcome when they leave care. And then lastly, we're working on AB 2520 around making sure that COCs, continuums of care, have youth-specific coordinated entry. This was held this year just due to cost of the bill, and we are coming back next year with a commitment from the author to reintroduce it. So I did just leave it on there just in case. So that's all for right now.
Great, thanks, Kim. And in our TAE collaborative committee with the COC, we went through all of those this month. So thank you. So really quick, we're running out of time. We have 1 minute. So I'm wondering if in one sentence or less, each of you could share what gives you hope still around our efforts to solve and end youth homelessness. So I think what I would say is, like, the young people we serve give me hope and also bring me great joy. The grit, the determination, that keep showing up for themselves, and how fierce their own self-advocacy is. I think that that's actually moving the needle in our work. How about you, Kim?
Hope is that people are paying attention, and actually we've been having successes and wins and wanting to invest in young people. And so that gives me hope that we can continue to do more.
Great. Darla?
Yeah, I think like you, Amy, definitely like young people being engaged in the work, joining us in advocacy. And I've just seen a lot more engagement, a lot more passion and attention just across the country and communities, a lot more people wanting to work on preventing and ending youth and young adult homelessness.
Great, thank you. Bex?
I think when we applied for the YESI funding opportunity I mentioned earlier, we did a survey, and we had 264 young adults who've experienced homelessness in Orange County responded to the survey. That gave me such insight, and it just really kind of inspired me around how important this is. And out of those 264 people who responded to the survey, 70 of those young adults said, I want to be a part of making change. That is just so exciting. And that is why I really hope the HUD does fund us and provides us with the YESI funding so that we can actually move things forward. But that, just like what you were all saying, that determination, the young adults that I personally met in that process, hearing little pieces of their stories and their hopes for how they want to be involved in creating systems that are actually like effective, that is just incredibly inspiring. I want to say thank you to each of you for joining us today. This was incredibly informative. And as I'm sure everybody can tell, we could have kept talking for a lot longer about this. So thank you so much for sharing your expertise and your insight. This does bring us to the end of our chat today. This will go up on our YouTube, as I mentioned earlier, for anybody if you want to re-watch it. We'll email out all of the links that were dropped into the chat box. We'll email all the links. We'll email the PowerPoint slides. There's a little poll that's popped up. Please feel free to take a minute to respond to that. It's really helpful for us to shape future community chats. And yeah, just thank you, everybody. Enjoy the rest of your Thursday, wherever you are joining us from, and we will see you next time. Thank you.